the major bone of the face is the maxilla. Why it's major? Because it articulates with most of the facial bones. In our previous presentation, we had a brief idea about the cranial bones. Cranial bones are the bones that surround the brain, and the skull is divided into two parts: the cranial part, the part of the skull that surrounds the brain, and the facial bones, the bones that have no relation with covering the brain. The rule that we cannot work without, and a concept that we cannot forget, is this: anatomy is a visual descriptive science. This is something we cannot give up at all. This is a front view of the skull. The frontal bone makes the bone of the forehead. Now, is the forehead part of the face? The answer is no, it's not. The frontal bone is a cranial bone, but most people think that the frontal bone is a bone of the face. It is not. Here is the bone that makes the center of the face, and it articulates with most of the bones of the face, and this is the maxilla. Now, the maxilla has different parts. The part marked with the red star is what is called the body. Now, this body is thick, and it has an air sinus, the maxillary air sinus, which opens into the nose, and this maxillary air sinus creates lots of problems in some people. And the second part of the maxilla is the part pointed at that holds the teeth, and it is called the alveolar process of the maxilla. Why alveolar? Because it has multiple sockets for the teeth to fit in. Then there is this part going towards the other facial bone, which is the zygomatic. So this part is called zygomatic process of maxilla. Then the maxilla is going to extend up towards the frontal bone, and this part here is called the frontal process of maxilla, which is going to meet the frontal bone, and it makes a suture with it. And then when we go medially, the frontal process of the maxilla is going to articulate with the nasal bone. The maxilla has a foramen. A foramen is a tunnel for arteries, veins, and nerves. And this foramen, or an opening, is called, as you might expect, it is the infraorbital foramen. Now, are all the parts we have just seen, the different processes articulating with the different bones of the face, are these all parts of the maxilla? The answer is no. There is a deep part of the maxilla, and this deep part makes the roof of the mouth, a bony roof of the mouth, and it is the hard palate. Which part of the hard palate? It is the anterior part of the hard palate, and it is called the Palatine Process of Maxilla. And posterior to the Palatine Process of the Maxilla, we have the last half of the hard palate, and this belongs to the Palatine Bone, which articulates with the Palatine Process of the Maxilla. Here we are looking at the base of the skull, the inferior surface of the skull, and the structure marked green is a bony part of the hard palate, the roof of the mouth, and it is made by a separate bone called the Palatine Bone, and it articulates anteriorly with the Palatine Process of Maxilla. Looking at this frontal view of the face, another large bone of the face is the mandible. This mandible is not part of the skull. It is a separate part. It is not part of the skull because it articulates with the skull with a synovial movable joint. But is it part of the face? The answer is yes, it is. This is a lateral view of the skull, and now in the face part you will see the lower jaw or the mandible, and this the view shows us that the mandible is made mainly of two parts. The part that goes up to articulate with the skull, and this is called the ramus of the mandible, and the part of the mandible that holds the teeth and the main other parts of the mandible is the body. This is a side view of the mandible, and the first part we will be talking about is the part of the mandible which articulates with the base of the skull, and this part is the condylar process. A process is a protrusion of a bone, and why it is condylar? Because at the upper tip of it is a condyle. What is a condyle? It is an egg-shaped process of a bone. The green marked structure is the coronoid process of the mandible. It is a protrusion from the ramus of the mandible, and it serves as an attachment of the very strong muscles of mastication. This is the lateral view of the face, and the structures inside the yellow circle is the point of contact or the joint between the mandible and the skull, and the mandibular side is the condylar process, and the base of the skull part is what is called the mandibular fossa, part of the inferior surface of the temporal bone. The green marked structure is a notch. A notch is something that you can sweep your finger around, and this is a notch between the coronoid process and the condylar process. The green marked structure is what is called the alveolar process of the mandible, and it is very comparable to the alveolar process of the maxilla. In a lateral view of the face, just above the mandible and the maxilla, you can see the green marked bone, which is the zygomatic bone. This makes the sides of the face just inferior to the orbits. In this lateral view of the face, and we can see that this green part is made of two halves. One half is coming from the zygomatic bone, and it is going towards the temporal bone. Therefore, it is called the temporal process of zygomatic bone. Now, the posterior part of the zygomatic arch it is coming from temporal bone, and it is called zygomatic process of temporal bone. These two processes, they unite by a suture and form what is called the zygomatic arch. In an anterior view of the face, the green marked structure is the zygomatic bone, and it makes the sides of the face just to the side of the maxilla. A closer look at the zygomatic bone, where you can see this is the body of the zygomatic bone, and it articulates with the maxilla, which is on its medial side, and it articulates with the temporal bone, and it sends a temporal process of zygomatic bone to make the zygomatic arch, and superiorly it articulates with the frontal bone through a suture that is subcutaneous, and you can feel this suture in your face. And then the zygomatic bone also forms part of the lateral wall of the orbit and part of the floor of the orbit. Now, we had an idea about the three large bones of the face: the maxilla, the zygomatic bones, and the mandible. And now we have a group of small bones that contribute to the skeleton of the face. This is a view showing the green marked structures. They are two nasal bones. This is a closer look at the nasal bones. They are two small bones that join each other in the mid-sagittal plane. This is a closer look at the two nasal bones. You can see a faint line separating the two nasal bones. There's one on the right and there's one on the left. Now, they articulate with each other through the way of suture, and superiorly they articulate with the frontal bone, and laterally they articulate with the frontal process of the maxilla. The green marked structures are the nasal bones, and I will leave you to comment on what you have learned according to the shape of the bones, the articulations, and so on. And this front view of the face, now the face has four major openings, two orbits, then a nasal opening in the middle, and lower down is the oral or the mouth opening. If we look at the two orbital openings, you can see that there are two green marked little bones on the medial wall of the orbit. This green marked bone is present in the medial wall of the orbit, and it has a depression. This depression is called the Lacrimal Fossa, and as a lacrimal bone, it is going to articulate with the frontal process of Maxilla. What makes the center of the face is it is the green marked bone, and you are supposed to be able to recognize its different parts. This is a view of the basal part of the skull, and we are going to address the nasal cavity. The nasal cavity is divided into two parts, right and left. This division is done by a septum. The septum is half made of bones and half made of cartilages. In this view, we can see this green marked bone, and this bone is called the vomer. If you look into the nasal opening, you can see a red line. This red line is indicating the nasal septum that divides the nasal cavity into two halves. Now, concentrating on the nasal opening, and here there is a bone that is central in the skull, and it shares in the formation of the medial walls of the two orbits and the upper part of the nasal septum. This is the ethmoid cranial bone. Looking at the nasal septum, the green marked area is the lower part of the nasal septum, and it is made by the vomer. This is a view of the vomer we have seen before. This is a sagittal view of the whole of the skull, and the green marked structure is the bony part of the nasal septum, and it is made of two halves. The upper part belongs to the ethmoid bone, and the lower part belongs to the vomer, and this is the bony part of the nasal septum. This green part of the nasal septum is a part of the ethmoid bone. The green marked structure is the lower part of the bony part of the nasal septum, and it is inferior to the ethmoid part, which is called the perpendicular plate of the ethmoid, and this is the vomer bone part of the nasal septum. Looking into the nasal opening, we have seen the different parts of the nasal septum that divides the nasal cavity into right and left halves. Now, in this image, we can see a green structure that is coming out from the lateral wall of the nose. This is called middle nasal concave. It is a protrusion of the ethmoid bone into the cavity of the nasal cavity. Looking at the nasal cavity, you can see another green marked structure. This is the third concave, or the third protrusion into the nasal cavity. The first one was a superior one belonging to the ethmoid. We could not see it because it is higher up. We have seen the middle nasal concave, also belonging to the ethmoid bone, making the lateral part or the lateral wall of the nasal cavity. And this is the lowest one, and it is called the inferior concave. It is a separate bone attached to the maxilla. It is not part of the maxilla or the ethmoid bone.